it has a circle shape, and it has to put in the neck of womb.
Okay.
So it's like condoms, but maybe for women.
Okay, I didn't know that. Okay, so that's good. Now we know what is it. Okay, talking about yesterday, I think we have a little delay. So please be patient with my internet. I don't know what is going on.
Okay, don't worry.
Okay, I was telling you that yesterday we were talking about different topics. So I have a questions for you.
Okay.
Traditionally, eyesight problems are corrected with spectacles or contact lens, but or contact lenses, right? But do you know some other ways to correct these eyesight problems?
The most useful therapy is with surgery, with laser. I think that the people
I know
prefer that.
that there are two kinds.
Mm-hmm.
Yes, sorry, continue.
Sorry, what did you say?
I was telling you that I think there are two types or two kinds of laser surgery. I don't know if you can to me a little bit.
Well, actually, I know only one technique. I don't know about the two, but I have heard that the people prefer surgery, laser surgery, because it's like a more radical solution. So you got the surgery, and then you don't have to use glasses or contact lens or anything. You are okay with your eyes. Well, no, with your vision.
Okay.
Hmm.
So what do you think are the advantages and disadvantages of this technique?
Mm, the most advantage will be that you won't use the glasses or contact lens. I think that's the more advantage. And disadvantage, mm, maybe don't have too much disadvantage, but if the doctors don't have a good precision, maybe it could cause damage in your eye. And the
Okay.
other thing I have heard that some people don't feel good after the surgery, which means you expect that you can see normally again, but some people feel like the vision is still is not still good.
Okay. I have heard about it. I was telling you two techniques because I have a friend that he got the surgery and uh, doctor told him that one of those techniques are the one that you got the surgery and tomorrow maybe you can go to your home
Mm-hmm.
and you can see, so it's just one day
Yeah.
for your treatment, and the other one is like you have to wait a week to take off the band. I don't know what is exactly that, but I don't know. I was heard about that. So
I have here only the first
okay,
one
then
because here
yeah.
my sister wants to get the surgery, and we visited a lot of ophthalmologists, and all said that okay, you come, we do the surgery, and in the afternoon you can go home. So we thought that, I don't know,
Wow.
we
That was
don't was ¿cómo es convencido?
convinced.
Convinced about that. So she didn't take the surgery.
Okay. So that's interesting. Now we have another techniques. I have to think about that and try to make that surgery. I don't know. Maybe it will work for me too.
Yeah, maybe, but maybe I think you have two options, and will be, well, you have one, the glasses, and the second, the surgery, because I have heard and I have studied that contact lens produce damage in the eye. With the time, maybe you will get a cataract.
Oh yeah.
Uh-huh.
Okay. That's good to know.
Or maybe
I
dry
won't use
eye.
them. Okay. So, talking about another topic. Yes, I know that this is typical.
Yes,
Even after surgery, that's typical. So they have to go and come with their little
drops.
yeah.
Yes, that's true.
Okay. Okay. So imagine you got a patient with an hypothyroidism, for example. How can you refer or make a referral letter to an endocrinologist? Imagine you're writing down a letter.
Okay. Um, Dear Dr. Encinas, um, I have examined a patient. She has 30 years old. She came to my consult and described she weighed a few kilos, and she don't eat too much. She tell me too that she is losing her hair a lot of. So I have done some laboratory tests, and I found alteration of TCH, T3, and T4. So I'm thinking about maybe she could have if no, hypothyroidism. So I want please that you check the patient and give you the treatment as specialty. Special, no, specialist.
Okay.
Yeah.
Specialist. Yeah. Okay. That was a complete letter. So let's continue about another question with other topic. What is the attitude to contraception in your country?
Attitude about the people, what the people think about it.
Yeah, if people use it, don't use it, they know, they don't know.
Well, the people accept the contraception.
Hmm.
The people know it. I think the religion in this topic is the doesn't a problem. But I have seen that more teenagers don't use it. I don't know why. We try to teach about all the type of contraception, and the most important reason to prevent the pregnancy. But really, I don't know. I don't understand why they don't use it. Because here in Ecuador, we have higher scores of pregnancy, higher levels to pregnancy, no, to adolescent pregnancy. So this is really preocupante.
It's something to worry about.
Yeah, in the government spends a lot of money trying to educate, even give contraception, free contraceptions. The most usual are condoms. For example,
Yeah.
in health centers,
Mhm.
public health centers, you can get it any contraception free. But the most people, teenagers, don't use it. So I don't understand why. I don't know how's the situation in your country, but here doesn't use it.
It's almost the same. I think Latin America is it's so, I don't know, maybe they don't understand the impact that their behavior cause or is causing around the world, but we have to contrarrest that, right? So at what age do you think females should be prescribed contraceptives?
Once they get her first period, because I can tell you an age because I have seen in hospitals kids with other kids. So it's like shock to
Yeah.
me. So I remember
Yeah.
years ago the education was about more religious topic, like you have to wait to marry to someone.
With more values, with more values,
Uh-huh.
right?
Yes, and now all has changed, and now the people say, okay, if you don't want to wait, por lo menos, ¿cómo es?
At least, at
At
least you can
least,
use the contraceptive.
exactly, exactly.
Yeah, that's for sure. I totally agree with you. I was thinking that maybe, I don't know if it works in your country, but here we used to have something called family planification or something
Oh,
like that
yes, yes, yes. We
in
have.
rural areas, and it was helpful, I think, I thought. But now, I don't know, because they have children like 2 years, three, four, five. I don't know what's
Yeah.
going on. I don't know if it's working or it's because of the bonus that the government is giving
Maybe another
by
reason.
child. Yeah. So I don't know, but it's a problem. So education is failing here. I think in Latin America, I don't know.
Yes, totally. I
They have
remember that in my consult, I had a patient, a mother, and she always came each month with a special, I don't know, with a special like a book, and she told me, okay, you have to check all my kids because I have to get the bonus. And she had maybe 5 or 6 kids. And
wow,
if she doesn't
wow,
check the
because of
kids,
that.
she lose the bonus.
Mhm.
Yes, and I think that's
Yeah, it's a problem. I don't know. We have to. I think government has to change its politics in
yeah,
order to work with health and the other side an economy. I don't know, but something is going wrong.
yes, and I only see. a family or maybe a mother who has three kids, and I said I don't know how she do it. I even think about it. One kid with my dog, I have enough.
Yeah, yeah, I know, I understand that. It's a lot of responsibility. I don't know how do people uh, can take care of so many children. I don't know. But oh my God, we can still talking about this topic because it's interesting. But please, first, I will send to you my little questionnaire.
Sure, sure.
I
Okay,
will try
teacher.
to take. Okay, so what do you think then? It's good that this prevention thing it has to be for free.
I think yes, because some people feel shame to get it, and maybe to go to the doctor in the privacy consult is more easy to them.
Okay. Okay, Liz, thank you very much. It was nice talking to you. So I have to give welcome to Carla.
Yes, teacher.
Okay? See you
Thank you so
tomorrow.
much. See you.
Thank you. See you. Hi, Carla. How are you?
Hi, teacher. I have a questionnaire. I have to close it.
Oh, yes, please.
Okay, okay.
This is it's for the end. I was just
Yeah.
talking to Lee.
Okay.
Okay, so how are you? How is everything?
I'm fine. Well, they are working on the street, so there's a little bit of noise.
Oh no, I don't hear anything, so don't worry. Okay, I have
Okay,
some questions for you about the topics we were talking about yesterday. Okay,
okay.
so let's talk about that. Traditionally, eyesight problems are corrected with spectacles or contact lenses. So, do you know another treatment that can be used to correct eyesight problems?
Which problem did you say?
Eyesight problem.
Oh, well, it depends of the age. If you are like, I think if you are less than 1 year, you can use a treatment when you put a small spot, red spot on their forehead. So they can look at when they are babies, they look at it and they can fix a little bit the opposite.
Strabismus.
Yes, that's what we are talking about, right?
Yeah, it could be a problem, yeah, but in general, eyesight problems like I don't know, my deficiency of seeing without spectacles, for example.
Oh, okay. Like, well, you can treat it too. If you use lenses in your first years of life, like to the 8 years old, you can fix your eye problems. But if you don't treat that correctly, you will use lenses for life. So it's something that the most of parents don't know that they have to take their kids to the ophthalmologist. And well, if you go in time, you can fix them. If it's not something very difficult, right? But if it's something like lenses measure that you need to something you can fix it in early ages.
Okay, that's interesting.
Yes.
What do you think about laser therapy has become a popular alternative? And what are the advantages and disadvantages that you find out?
Well, find it depends of your job. If it's something that if you are uncomfortable with lenses, you have to do it because it will help you a lot. Like if you are a surgeon, you cannot use
Where?
lenses. You when you are a surgeon, like you can wear lenses, or a military thing, someone who is working on the streets and they can fix their lenses all the time. So maybe in that type of persons, you can wear the laser, because all the surgeries have their their danger. It's not secure at all. We don't know if you have like 1% that things can go wrong.
Mhm.
So well, you have to think about it. But I think if your job demands you to be without lenses, so you have to do it. It's better for you. It works. I
Okay.
think it's an advantage. Yes.
Okay, I understand. And I agree, though. Okay,
Yeah.
so imagine there's another topic, okay? Imagine you have a patient with hypothyroidism, okay? And you have to refer to another doctor, to an endocrinologist for sure. So, how do you refer that patient? Imagine you are writing a letter to an endocrinologist explaining what are the signs and symptoms of your patient.
Well, okay. I will send. I will write a certificate that they have um, long time. What is this? Tiredness.
Okay.
Maybe they have a body type, especially of the hypothyroidism. Like they are tiny and they are thinner, and they always have cold. Their hands are always cold. They usually say they have fatigue. They don't do the things with the same energy as usual. And maybe that they are having trouble staying awake in the work at work. Um, and even if they eat a lot, they can get fatter. So it's something going on there. Um, well, I will say I think it's all that things that type. mm,
Okay.
Uh,
So you're explaining to this doctor that you're suspecting that this patient might has hypothyroidism, right?
yes, because there's a lot of syndromes that we cannot discharge. So it's their work to see if they have another kind of something going on there. Yeah, but it fits to hypothyroid hypothyroid. How you say it? Hypothyroidism.
Hypothyroidism.
Hypothyroidism type, I think. Yes.
Hypothyroidism. I know it's so difficult.
Yeah.
Ah, okay, thank you. Then I have a question for another topic, right? What is the attitude to contraception in your country? So here, right, in Bolivia, what do you
Contraception.
think?
Well, we have
Yeah, what is the attitude?
we ask to the female patient at age of 14 or more that they had the right and the health the health insurance cover for free all types of contraception apparatus, so they can get it for free. But we usually,
That's right. I didn't know.
yeah, you if you go to a
Wow.
health center, you can ask for the contraception plan, and they give you 20 condoms, or if you want a consult with a specialized personnel, you can go and they can put you on the I forgot the name. How, what is the name of the thing that you have in the arm? Is the
Uh,
I look at the yesterday. We have it, but it's for free.
yes.
You can put it on.
And okay.
Well, I'm not finding
Oh,
it, but it's the little thing you put on your arm, and you can just go and they put it on like in 15 minutes. So it's not a hard thing, but we have to explain always two things. The condoms doesn't affect hormones, and,
yeah.
and also the copper tea copper.
Yeah.
Uh, but the all the other contraception apparatus, medicines, everything will affect hormonally. So we don't recommend that if it's someone who can gain weight,
Mm-hmm.
because they can gain a lot of weight in the time. So if you are a small type body type, you can go for all these things. But all everything is open for women. There is not
Yeah.
something we don't recommend. Everything is open.
Okay. So, at what age do you think females should be prescribed contraceptives?
We uh, we have to do it at 14 years old, because we have a lot of teenage pregnancies. So it's better to give them give the choice there. But we don't like promote we don't promote that things, because it's not secure at all. It's not completely secure that you won't get pregnant. There's always 1%, 2% of probabilities that you will get pregnant, or you will have another venereal disease. So it's not recommendable if you don't have a partner of life. If
Yeah.
you, we always clear that to the patient if they are less than 18 years old. But
Okay.
if they have 18 years old, we explain everything, and we also explain it. But they they are older; they can take their their chances.
They can understand better, right?
Yes.
Okay. So we got something like a familiar planification or something like that in rural areas. I don't know if it's still working or or not at all.
Yes. Yes, it is working. We have the familiar carpets
Yeah.
where we work with all the familiar things that they have to know. But it doesn't work as well as it works in the city, because they have a different mind. They think they have to have children because they are women, and we cannot fix that yet. It will
Yes,
take
that's right.
yes.
Okay, Carla, thank you so much. We
Thank
don't
you.
have enough time. I will send to you my questionnaire, please. Can you fill it for me?
Okay, it's done.
Thank you. I will take a picture. Just, oh, okay.
Okay.
So see you tomorrow. Thank you very much.
Thank you. Goodbye. Good afternoon.
Good afternoon.
See
Bye.
you.
Take care.
See you
Hi,
later.
Salome. How are you? Good afternoon. I'm so sorry.
Don't worry. I'm fine. And you, what about your day?
Was good. It was good. I was really busy, but now I'm like, okay, calm down.
Relaxing. That's good.
Yeah, it's a good time for taking a little chat with you, a little speech. Okay. So did you do your homework? Do
Yes,
you know?
I already sent you.
Okay, thank you. Uh, I don't know. My mind is flying. So
Really busy. I think you're really busy.
yeah, I'm so sorry, but I'm glad you can beat it. Okay. So do you remember that we were asking yesterday what was a diaphragm?
Yes,
And you know the answer?
it's a little complicated to explain, because it's only with we can imagine all the things, no? But it's like a feminine condom that you insert uh, inside of you before you have sexual relations, and that is that impede that the spermatozoid get into the ovary of the woman, of the utero.
Okay, and I understand now. I didn't know about these tools, but interesting. Okay, so let's talk about another topic. I will make you a few questions, okay? Traditionally, eyesight problems are corrected with spectacles or contact lenses, right? So do you know another way to correct eyesight problems?
What is the meaning of cotaplexis that you say?
Eyesight?
You said contaplexos.
Contact lenses.
What is the meaning of that?
The spectacles, little spectacles that you use for your iris and
Okay.
pupils only in order to see better or
Okay.
to look better if you want.
Okay. So you asking me about if other way to correct the vision?
Yeah.
Yeah, practical. That is depend of the disease. For
Okay.
example, I have keratoconus, and that is that kind of disease that you only can correct with a cornea transplant. But in the way you need to be responsibility with the eyes. In my example, I can brush my eyes like this. I can't cry too much. That is funny, but it's really because you know about the chemic that the lagrimas have. I don't know how to say lagrimas.
Tears,
Tears.
tears,
Uh,
tears.
tears. And in this is because the cornea is like a circle, because when you have keratoconus the cornea start to be like really really thin, and when the cornea touch the other between them, they like collapse it.
Okay.
Okay, and after that you can be you can become to be blind. So that is really complicated,
Really
but
dangerous then.
yes, but in the transcourse of the disease, you can have the cross linking, that is a surgery for your eyes that stop to the cornea continue be thin. But the really treatment for this pathology is a cornea transplantation.
Hey, I didn't know about that, but it's a big problem. And you are taking care of you so
Yes,
well.
it's since 2000, I think 16, I know that I have keratoconus. But I'm okay. I go to the doctor each year for knowing how is my process of the keratoconus, but I'm okay.
Hmm? Okay, but it's controlled then.
Yes.
Okay, that's right. In recent years, for example, laser therapy has become a popular alternative, right? What
Mhm.
are what do you think are the advantages and disadvantages of this technique?
Okay, it depends about the teacher. Do you listen? Yes.
Yeah,
Yeah. Okay.
it's a little unstable, but I don't know.
Okay. So
Okay.
continue. The alternative therapy is depends of the disease. So if we talk about the eyes, I'm not actually I don't know if has alternative therapy for the eyes, but for the other disease, for example, diabetes. I have a grandmother with diabetes, and I don't know who, but somebody bring there to a therapist, main alternative therapist, and
Okay.
that was is not was good. I am ni favor ni contra, but I don't like it because with my grandma for diabetes they give her too much water. I don't know with which plants or what kind of water, but she told us that she started drinking that water, and immediately she started vomiting all like 1 hour,
Throwing up.
throwing up,
Yeah.
for 1 hour, all the food, and after that only liquids. It's not water, but I was thinking was liquid of the body of the for the body. Yes. So I am only I know about that case, but for the other way, I listening about the alternative therapies with the pain, and I am a little agree with that because the pain is horrible, and I know that everybody in the world maybe one time on their life feel a pain, and I think that like humans we are not no nos merecemos, we don't need
We don't deserve.
we don't deserve to feel pain because we are humans.
Yeah.
And that is a kind of it's a methodology about rocks or maybe plants, grief, that I am agree with that because it's not invasive your body. It's like okay uh, in the nature, or in season that you can do so. I think is okay for the person that believe in that and feel better with that.
Okay. It can work sometimes because of the, I don't know, faith that people put on those kind of things, right?
Mhm.
But on the other hand, we have laser therapy. What do you think about this? It works? It doesn't work?
In their eyes. Yeah, I think works because I have friends that they don't like using glasses, and they can't use sunglasses, because we need to be with glasses all the time, and the sunglasses are not bigger than this. So they did it, and they have good results, and they don't need more glasses. So I believe in that. Uh, the other thing for the laser surgery function in our eyes is the care after the surgery, because if you don't care and there is okay, I go to a place with a lot of sun, I will brush my eyes, I will be at the cell phone or the TV all the time, that couldn't be good for the operation. Richard, are you there?
Salome, I think we have a problem with the internet.
I
Do
only
you hear me?
Yes, I only listen your voice, but I don't see you. It's like freezer
Oh,
screen. Teacher, are you there? Oh my God. I don't know. I think the teacher has a problem with internet, so we can wait a minute, please. Yes, teacher. Okay.
Hi, Salome. I'm so sorry.
Whoa, teacher. I'm here.
I don't know what happened. What is going on with my internet? It's so bad. I don't know. Okay, let's continue, please.
We were talking about the care about after the surgery, and
Yeah.
finally I was saying that if we don't take care about our eyes, that probably won't have a good results the surgery. But I think that function.
Yeah, I think that function too. So, on the other hand, let's talk about another topic. Yesterday we were talking about contraception.
Hmm.
So, I want to know what is the attitude to contraception in your country? What
I
do people think?
I think in Ecuador is accepted by the people. For the woman, I think is okay. When I was in the first care of health, the woman choose the injection.
Okay.
That was the more chosen by the woman, the injection. I think it have a good reception. That, but how I work with indigenous people, that is a disaster.
Yes, I was thinking
A
that.
really disaster because firstly she wants to start with the pills, but the thing is that they forgot take the pills every day, so that is scary but with them.
Mhm.
But when we try, they have a fear about the injection, but
Yeah.
we're trying to convince her that is the best because she has like 4, 5, 6, 7 until 9 babies childs, and
Yeah.
it's not too much difference between them. It's like 1 year, and after 1, 2, 3, 4, maybe 7 and continue, are
Yeah,
not
I don't know.
difference. So I think that is complicated, but if we try to educate more the people, more the women to what is about this, because other is not only have too much kids, is too about the health of us, and especially the women. So in Ecuador is the women use the pills or the injections in the
Injection.
Uh-huh. And indigenous people use, but have to be like beg them to please use anti-conception and the pill.
Oh,
Right?
that's really bad. It's almost the same here. We have that problem, education, because our people, for example, here we have bonus that government give to these people in order of how many children they have, and that's because that's why they they have children like you were
Rabbit.
saying, yeah,
Yes.
one next to the other, right, just like this. So I don't know how they do, but they do. Okay.
Yeah.
So the problem is education, I think. We have to continue do that. I don't know, but thank you very much, Carla. Carla, I'm sorry. Salome, I'm so sorry.
Don't
I
worry.
know you work a lot with people in a rural area.
Yeah.
Uh, do you have the familiar planification or something like that?
Yes, that is not to, for nurse is not to be cool, because sometimes the husband or the men of the house are like rude about that topic, and is okay, doctor, go ahead, eat your work, so go ahead. And it's
Yeah,
like, okay, nurse is outside about that, because the appointment is with the doctor,
yeah.
in familiar planifications.
Okay, okay, pretty good. So yes, we have to educate them. Besides, they don't want to.
Hmm.
So okay, but thank you very much. Right now, Salome, we don't have much time, but we will talk about tomorrow of another topics. Okay.
Okay, teacher, thank you.
Okay. Please, I will send to you. Ah, there is,
Okay,
there is.
done. It's done, teacher.
Thank you so much, Salome.
Okay, teacher, see you tomorrow.
Okay, see you
Bye.
tomorrow. Goodbye. Have a great